Dr. Kristie Ennis. Today we are going to work on core muscles that aren't talked about very often and are not worked on very often either, but they play a big role in bladder control, preventing prolapse, and even increasing sexual pleasure. Now, as women, these muscles tend to get weaker over time due to things like childbirth, pregnancy, menopause, and other fabulous hormones, and anything that increases that intra-abdominal pressure, so holding your breath and bearing down like in constipation. And we are going to work on those muscles to fix that today. Exercise step 1 is getting that basic kegel down. So our pelvic floor muscles make a sling. They go all the way to the front, all the way to the back, all the way. They start in the front and go all the way to the back. So if you ever have to stop gas or you have to pee and you need to stop yourself, those are the muscles that you're usually feeling. However, oftentimes I see people do these really incorrectly. They suck everything in and are kind of negating those pelvic floor muscles. So that's what we're going to go over first. So you won't see me doing anything unless I raise my eyebrows, which that can happen too, and that's okay. But again, to do them correctly, you should not have other muscles that are really activating, right? So it's not lifting your butt up, not holding your breath, not sucking in that belly. So I'm going to give you a few visuals here to think about. We really want to be pulling up and in. So don't try this at home, and I know it's kind of a weird visual, but it usually works to get into our heads. If you think about pulling a marble up and inside, like you're drawing it up and in towards your belly button. Or another kind of good visualization is like a little tissue, right? A Kleenex. That's the brand name, a tissue, trying to pull that right up and inside. Now, sometimes you will feel like, oh my goodness, I kind of feel that in my butt. And that's normal because, like I said, it goes front to back. So it does go around the anus, but you just don't want to squeeze your butt muscles. So that if you are sitting, if you squeeze those butt muscles, right, it's going to lift you right up. So that's a way to know that you are not using the right muscles. Now, sometimes people still go, geez, I just have no idea. Nothing else is moving. I'm breathing, but I don't know if I really can feel it right. Now, there are multiple positions you can do this in. I usually start people with sitting, though, because you get a little bit of biofeedback. I've got my handy dandy hand towel. You can roll this up, put it right on your seat, kind of sit astride of it. And now you're going to have a little extra pressure in that area so that when I go to pull up, I can feel like I'm pressing away from something. You can almost feel like that towel's coming up a little bit. That is one way to know if you are using those muscles correctly. Another way is to actually check internally. Now you can use your partner for this. You could use your own finger. You can use some sort of tool or device. But if you are squeezing around something inside, and if it's your partner, they should be able to give you feedback that, oh yes, I feel like you are that you're pulling up and in. What we don't want is that pushing down, which is where a lot of people go wrong. So you can get feedback from the towel, feedback from a tool or device, and they do make those as well. I can link that, or from your partner to let you know if you are doing that correctly. And once you have that down, right, you've got the muscles activated properly, you want to make sure that you're doing them for the correct amount, right? What the heck is that? So I'm going to take away my towel. To do this exercise correctly, you want to take a nice breath in, and it's as you breathe out, as you exhale, that you're pulling up and in on those muscles. And to do a little test, you can try, just like I'm doing, talking and trying to hold those muscles for as long as you can without squeezing, without really holding your breath, and without doing this. If you can't do that for very long, that's okay. You're just getting a baseline. So if I do this and I can hold for about 3 seconds before my muscles kind of waver, I'm like, oh my goodness, I have no idea if I'm still holding that or not, that's where you start. So you would start with 10 repetitions of holding for 3 seconds, and you would do that 3 times a day. The goal is to get up to holding 10 repetitions for 10 seconds. Once you've got that down, you also want to add in what we call little quick flicks. So it's where you go, woo, fast squeeze, let it go. So you notice I lifted my butt there. That wasn't good. Little fast, let it go. But you really want to make sure that you're letting go completely. And those are muscles, those fast twitch muscles, that part of the muscle really helps with that incontinence. So we want to make sure our endurance, long distance muscle fibers are working and those fast twitch muscle fibers are working too. So that's kind of the basics of the Kegel, right? Breathe in, exhale and squeeze. Hold for as long as you can without using anything else. And then after you've done that set, you can do your little quick ones, again about 10 or so. And then we can move on to the next step. Step 2 is now activating some of those other core muscles to help get even stronger. And notice I'm lying down, so you can do this on the ground or you can do it on the bed. But we're starting on the ground or sitting to do some of these exercises because when we stand, we have to fight gravity even more, which is even harder. So we'll get to that eventually. So they have shown that doing some abdominal work, some specific abdominal work, actually helps get those pelvic floor muscles engaged even better. So once you know how to engage those things, we'll add some other stuff to it. So we're gonna go, nice breath in. As you breathe out, you're gonna think about that little Kegel, right? Kind of pull that in a little. And then you're also gonna think about pulling that belly button gently towards your spine. Not a suck in, right? Not Thanksgiving Day tight pants, but just, you know, a little tightness in those pants that you have to kind of pull in. From here, still breathing. If you need to let go of that Kegel at any time, please do so, okay? You don't have to hold it for this whole time. But I'm gonna put my hands right on my hips so that I can make sure everything stays level. And then we're adding a little march. So right now I do still have my pelvic floor muscles engaged as well as what's called that transverse abdominis. But like I said, if you have to let that Kegel go, do it, but try to keep that belly button pulled in. To make this a little harder, you can add in some arm movement too. Now we're talking about some brain work too, right? We have to get the coordination in. If you can really hold all of that stuff while still breathing and not pushing out, then you can bring your legs up and you can add that same type of motion. But remember, always start on the ground. Also, one more to do with those feet on the ground is bringing that leg just right out to the side, challenging things a little bit more in here. And then one more exercise that involves kind of this middle area is a little bit of a crunch. They've actually shown in research that that does really strongly activate things. So hands are going to come behind the head if it's comfortable. If you're tempted to pull your neck, keep your hands across your chest. Other than that, a nice, again, breath in if you need to reset that Kegel and those transverse abdominis muscles. And then it's just a little lift up. Notice I'm not lifting very high, so I'm not putting a lot of stress through that spine. We're really focusing right down in here. So about 10 to 15 reps for all of those exercises, if you can, and they feel good. And then one last one here on the ground before we move on a little bit more. If you have prolapse, which is where one of those organs comes down, the bladder, the uterus, or the rectum, a lot of times you'll know because you can almost feel something there. You'll have a pressure and a heaviness sensation. And if not, definitely check with your therapist or doctor. But I often will have people make sure that they're doing some of their Kegels with their legs up. Now we're using gravity to kind of help shift things here. Sometimes even just lying like this feels awesome, especially at the end of a day when we've had gravity working on us all day. But same concept in that you're gonna do that little, right, pull in. You can even add some of your little crunches in this position as well. And like I said, just make sure you try to do at least one set like this. A progression, a little bit of that legs up position and working some of that core even more is a bridge. So again, breathe in, breathe out, pull those little Kegel muscles in, try to hold that as you come to that bridge. If you need to let it go at any time, you go ahead and do it. The goal is to try to hold it that whole time and then let go as you get down. So inhale, exhale and squeeze, lift, lower, and down. And again, about 10 repetitions of that. Also, again, that's the next kind of level there, right? From here, we're gonna go hands and knees. We're gonna get a little yoga-like right now. Spinal mobility is actually very important too in the pelvic floor function. So we wanna make sure everything's moving while we're activating too. So same start point, right? Inhale, exhale, and squeeze. And then we're gonna go and arch and lift that head, squeeze those shoulder blades. And then round everything. And this is usually where it's harder to hold. So again, If you happen to let go, it's okay. Just come back to that start position after you've done a repetition and re-squeeze. You'll still get benefit out of this even if you're not actually doing that kegel component, because we are getting some nice spinal mobility here. So again, about 10 repetitions or so. Our last progression is now working into standing and some functional activities too, right? Because we want everything to be working when we're actually working too. So usually where I start people is a little sit to stand. So breathe in, exhale like normal as you squeeze. Trying to hold that, you're gonna go ahead and stand up. So now we're working those legs. We all have to stand up and, of course, get back down during the day. So I have found sometimes too that it is easier to do it as you stand versus as you go down. So just pay attention to that. The goal would be to try to hold it the whole time eventually, but you may need to start out with just part of it. So a lot of times I'll have people squeeze, stand all the way up, let it go, and then re-squeeze again. Trying not to squeeze into the buttons. Same things apply, right? Then to go a little bit harder, if you want to actually do a full squat. You can hang on if you need to help you really sit back. But same idea, now we're using and engaging some of those bigger muscles now that those smaller ones know what the heck they're doing. You can play around with this a little and add lunges. I'll have people doing it while going up and down stairs or doing dishes. So super fun, right? You get to have fun now with your kegels. But there you have it, starting from the beginning all the way to the end where you don't need a physical therapist anymore. Thank you so much for tuning in today, you guys. If you want to get rid of pain anywhere in your body on your own with just one little portable device, don't forget to check out the Derma Edge. I created this while I was going through Lyme disease to help get rid of my pain on my own, nice and gently. It's patented and made in the US, actually right down the road in Laconia from where my office is. So don't forget, you can click the link here or in the description to order your own.